During a press conference they called in Kampala on 6th June 2023, the pre-medical interns gave the government an ultimatum of 24 hours to address their complaint of delayed internship deployment, or else they take drastic action.
We give an ultimatum of 24 hours from today to the Ministry of Health, 24 hours from today for the Ministry of Health to respond to our demands. If the Ministry of Health fails to respond to our demands, we as the leaders of medical interns will go back and consult all the medical interns of this nation, and together we will decide on what to do next.
Hours later, the permanent secretary in the Ministry of Health, Dr. Diana Atwine, held a Zoom meeting with the pre-interns. She asked the pre-medical interns who can afford to fund their internship, but the group has rejected the proposal, saying that it favors the rich at the expense of the poor.
Yesterday, the permanent secretary to the Ministry of Health clearly pronounced a position which we are not sure if it is our personal position or the position of the Ministry of Health. It shows that medical internship has been made for the rich. And I do not think that is the position that we pre-interns take. The government of Uganda has a mandate to ensure that medical internship is equitable and it covers both the rich and the poor.
The pre-medical interns attempted to march from Mulago Hospital to the nearby Ministry of Health headquarters in Wandegeya to address their grievances, but the police dispersed them outside the hospital gate and arrested some.
Bring others, those ones there. Bring others. What do you mean, say? Enter.
However, another group used another route and headed to the Health Ministry headquarters, but they were denied entrance at the gate.
Don't accept unfair deployment. They are saying deploy only rich people who can sustain themselves in internship. That is unacceptable.
The police moved in and arrested one as others took off.
Our police at Wandegeya is holding 3 pre-medical interns, and currently what is happening is that we are having a conversation with them to ascertain their situation and also how they were arrested. So the CID department at the Wandegeya police station will decide on which charges to investigate later on, and we shall communicate to you in case that happens. But as of now, we have not preferred any charges to investigate against them. We are rather interacting with them.
Later, the spokesperson of the Ministry of Health, Emmanuel Ainebiona, said that the proposal to have the pre-interns fund their placements was reached after some parents and the pre-interns themselves approached the Ministry of Health seeking alternatives as they await funds from the Finance Ministry. He added that the money will be refunded. Ainebiona says that this would save time, enable the pre-interns get their licenses, and also reduce the numbers, since a number of them graduate from universities and other institutions every year.
The Ministry of Health observed that the delayed deployment of the medical interns has distorted internship cycles, given that there are other students who are about to graduate from the various medical schools, and these will also compete for the same training facilities. It is against this background that the ministry requested the pre-medical interns who in the meantime can afford to apply for deployment in the internship centers of their choice. Dr. Twine added that they will be reimbursed if the Ministry of Finance avails funds.